Hi folks, welcome to the Daily Debate. Today's topic focuses on what the best intervention strategy is for a child who has ADHD. On one side we have Dr. Gallagher, who will be debating the benefits of behavioral therapy, and then on the other side we have Dr. Vander debating the benefits of medication. We'll begin with the opening arguments. Dr. Gallagher, why don't you go ahead and get us started?
I'm here on the panel today representing a viewpoint in which I discuss the benefits of behavioral therapy and why medicating an individual with ADHD can negatively affect their development. Through discussing with colleagues, we have discovered reasons why medication can be harmful to the individual. Overall, researchers found that medication has little positive effects on individuals and their academic outcomes and schooling attainment. Researchers found that medication can create a deterioration in academic outcomes, low levels of concentration, and increased levels of unhappiness and depression. They also found an issue surrounding the possibility that medication is a substitute for other types of cognitive and behavioral interventions which might be necessary to help children learn. What this means is that by making children less disruptive, ADHD medication can decrease attention spans across multiple aspects of the child's life. Finally, these researchers discovered that the medication itself can be a problem, especially if the correct medication and appropriate dosage is not correctly administered to the child. This directly affects the child because it can limit their academic learning and emotional well-being.
Excellent points, Dr. Vander. You may proceed with your introduction.
I'm here to stand for the benefits of medication in the treatment of those with ADHD. Medication for ADHD is well tolerated and common among many. There is a large amount of research that demonstrates the effectiveness of ADHD drugs for short and long-term treatment. Researchers have discovered that there is overwhelming support for the use of stimulant medication for those with ADHD, with more than half of children with ADHD taking Ritalin, which is a stimulant medication. It is the preferred form of treatment for children with ADHD simply because it works. There has also been evidence that has shown the need for stimulant medication for children with ADHD in order for them to engage and learn from psychosocial interventions that other doctors, such as yourself, are suggesting. The National Institute of Mental Health recommends treatment with stimulants and states that they are safe if used under medical supervision. I have personally read many studies that have proven the use of medication improving attention, short-term memory, performance of quizzes, homework completion, and note-taking. If that doesn't convince you of the benefits of medication, then the fact that there has been an increase lately in access to medication for those with ADHD due to the high usage should be a clear indicator of what type of treatment is more beneficial in this case.
Both of you make really strong arguments in your statements. Would you care to ask a question to your opponent to confirm your position in the debate?
If medication is so beneficial, then how come there has been a rise in research on the side effects it creates?
There's always going to be side effects, no matter what the form of treatment is. It's just one of the aspects of every treatment. Regardless of that, medication is shown to be effective, hence why more than half of those with ADHD are taking it. My question for you is, research has shown that cognitive behavior therapy takes years to be effective, whereas medication is almost instant. What if that child does not have years? How would you be able to effectively treat the child so that they do not fall in between the cracks?
Yes, you raise a good point. Behavioral therapy is quite a lengthy process. However, we firmly believe the benefits far outweigh the length of time it takes to be effective. In the end, it is more beneficial for the individual and overall a healthier form of treatment compared to medication.
You both have made some solid arguments for the benefits of your form of treatment. What you weren't expecting was for us to bring in a third doctor who has witnessed this entire debate and has her own conclusion of what the best form of treatment is. Dr. Rackett, take it away. After hearing both your sides, I believe you both talked about some important components in the intervention treatments for a child with ADHD. I think by combining both of your treatments together, a more thorough and beneficial approach can be taken to provide an individual with the best possible treatment. Recent research reports have constantly been concluding that by using both forms of treatment, we are taking a more well-rounded approach to the individual's health. Great addition to the conversation, Dr. Rackett. I think this is a great solution to a problem that we must take into consideration as future medical professionals. Would you look at that? Time is up. That concludes another special edition of the Daily Debate. Thank you to all three of our doctors for their informative research and conclusions. Join us next time as we discuss further medical questions.